My name is Dr. Cabrera, and this is a foam roller, which helps to increase the pliability of your tissues and helps to decrease injuries. This is a video to show you how to use it. So I like to start with the thoracic spine or the mid-back. You want to make sure the foam roller is right in the mid-back, and you want to begin to scan the area. Once you find an area that is extra tight or sensitive, you want to go ahead and micro roll that area for about 15 to 20 seconds or until that tissue releases. So after the thoracic spine, you want to pick a side and you want to start to roll into the rotator cuff and the lat muscle. Make sure to get both sides. Next, you want to go into the glutes here, and you want to again begin to scan the area, finding those tight spots. To increase the tension, you can also do a little bit of a figure 4 stretch, and again try to micro roll into those really tight areas. From here you can do a little bit into the TFL, making sure to not go into the hip joint. Again, scanning the area and then micro rolling. You go into the hamstrings. I like to do one at a time. Into the calf, making sure to roll in through the inner side and in through the outer side, making sure to not go too low to the Achilles tendon. Finally, you want to flip over. You want to just go into the hip flexor, making sure to roll the tight tissue, scan the area, micro roll, and then you can go into the quad. So that's it. Just remember that if the foam rolling is excruciatingly painful, to go see your medical professional. But foam rolling is great to use as a warm-up or as a cool down or both. I'm Dr. Cabrera, and I will see you guys next time.